Hey ho, let's go. Hello, my name is Dr. MarkAlain Dery. I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I do live in New Orleans, Louisiana. I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. You've seen me do these updates now for going on, that's month 11, so a year now. And in conjunction with the leadership of the ACOI, hello leadership of the ACOI, thank you for letting me do these videos. I hope these messages are helping you keep up with the latest COVID-19. I know many of you who are in the thick of the fight, and I'd like to thank each of you on behalf of all of us who focus on infectious diseases daily for a living, and certainly on behalf of the ACOI. Hello, ACOI. Also on behalf of the ACOI, I need to ask, are you registered for the ACOI virtual spring meetings? This guy's talking at it. There are 3 meetings coming up in early May from the 11th through the 15th, and they are focusing on 3 important areas, all with an opportunity to earn that much needed CME credit. So check them out on the ACOI website, and let's all get vaccinated so that we all can meet in October, because wouldn't it be great to do another ACOI meeting in October the way it should be. All right, moving forward together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progresses that we are seeing. On to the stories. So first, let's talk about the human trials that are going on with the Pfizer oral COVID treatment. That's right. There is I think phase 1 trials are complete for a oral treatment, a pill for COVID-19 after years. Wow. After a year plus having no de facto medication specifically to treat COVID-19 patients, man, does this dude exaggerate sometimes. Pfizer just announced that it is going into clinical trials on an oral antiviral protease inhibitor, which aims to prevent viral replication. It has been designed to be prescribed at the very first signs of infection, and it does not require a patient to be hospitalized to be administered. But there is an IV version for folks if they are in the hospital. This, of course, is exciting. It signifies a new phase of treatment, which is great news since we will continue to need to treat patients now and even when we're out of the pandemic. What great words, out of the pandemic. Oh, that sounds it's music to the ears. Music to the ears. All right. Now, the protease inhibitors work, as I'm sure all of you know, by stopping the replication of the virus in human cells. And so far, it has been shown to demonstrate potent antiviral activity against SARS-CoV-2 virus. Now, of course, any infectious diseases physician or even non-infectious diseases physician know about these protease inhibitors. Of course, from the mid-90s to about 2010, I would say maybe 2015, protease inhibitors were a really integral part of our HIV toolbox. And then eventually, once the integrase inhibitors were available, we started to kind of move more toward the integrase inhibitors. But for those, I put my phone on silence. But for those that were for those 20 or so years, protease inhibitors were incredibly important. And of course, we use protease inhibitors for Hep C treatment as well, and those are unbelievable that we can actually cure people of Hep C. So, all right. Of course, all of this means it doesn't mean that we don't still need the vaccine. Of course, we still need the vaccine. This is just another tool in the arsenal to fight the pandemic alongside the vaccines. And the hope is that with this drug, we can reduce hospitalizations. And Pfizer will be announcing more about this in a few weeks, and we will keep an eye on this. So let's talk about next the it's a little sad postural orthostatic tachycardia syndrome, also known as POTS syndrome, and we're starting to see that POTS syndrome is becoming, we're starting to see people who are experiencing some of the post-COVID syndrome symptoms, also known as long COVID, also known as long haulers, and they are starting to experience this postural orthostatic tachycardia syndrome, and it's basically a condition that affects the body's ability to control blood flow or volume. Of course, this is an autonomic nervous system disease, and of course, as we know, the autonomic system controls things that we don't actually really think about: breathing, digestion, heart rate, this sort of stuff. There are people who've contracted COVID-19, even mild cases of COVID-19, and they're discovering that even months later that they're still having symptoms of POTS syndrome, and without the body regulating blood flow, these individuals who have POTS syndrome cannot exercise. They experience dizziness and brain fog, and they even have extreme heart palpitations. Now, researchers don't know if there is more occurrence of POTS syndrome as an after effect of COVID, or is it more so after a viral or bacterial infection. So still trying to sort that out is important. Some patients are increasing their fluid and salt intake to expand blood vessels to keep them working, of course. Beta blockers are also diagnosed to help lower heart rate, and wearing compression stockings also can help with blood circulation as well. Some patients will get better spontaneously, while others will live with this condition right now. What seems like a lifetime, but of course we're only a year out, but for an individual, that's got to seem like a lifetime. So there is a drug called ivermectin, which may help. It does slow the heart rate, but it's not a beta blocker, and research is currently investigating whether POTS is an autoimmune disease, and understanding this can help determine if other drugs that help with autoimmune diseases can be used to treat it. So I think it's important to bring up here because lots of doctors miss this diagnosis. There is an organization that does advocate for people with POTS syndrome. This did get started because there was little attention given to the syndrome in medical circles prior to the pandemic. But now the organization is being bombarded by people who are suffering with it post-COVID. Now, the reasons doctors often miss it is because it is common for people who have become badly deconditioned while hospitalized to have similar conditions, and consequently, the diagnosis of POTS syndrome is really not on the forefront of our minds. So it also takes years for people to identify the condition. Now, the classic way to identify these patients is to use a tilt table. This allows doctors to measure vital signs while patients will lie flat and then they're tilted upright. And in POTS patients, the heart rate rises by 30 beats per minute or more just by standing for a few minutes. And some doctors say that postural changes in heart rate can be measured without a tilt table, but for diagnosis purposes, this is the most important sign of POTS. Now, interestingly, many patients with heart rate changes don't feel their hearts racing or pounding, but what really bothers them is the exhaustion or the inability to exercise. So we just all need to be more aware of this condition, evaluate our patients who have had COVID and who down the road may complain of fainting, have severe fatigue, heart palpitations, and exercise intolerance. And again, something else for us to consider for individuals that have had COVID. So, last story here is my favorite, and this is the story that we're calling the Fauci effect. So now I'm always looking for an upside for every downside of things, the silver lining, right? There have been few with COVID-19, but the one that I'm seeing now is that there's an increase in careers in public health. How awesome is that? Like, seriously, that is the coolest thing ever. Now, we need renewed interest in public health as we tackle the crumbling infrastructure of how it's being dealt with in this country. And I see this renewed interest as the scaffolding that supports our way forward in managing future pandemics. Now, public health schools, for example, saw a 23% increase in applicants for master's and doctoral programs from fall of 2019 to the fall of 2020. And that increase in that current application cycle is expected to even be bigger. How awesome is that? So everyone wants to be Dr. Anthony. Everyone wants to be Dr. MarkAlain Dery. Everybody wants to be Dr. Anthony Fauci. Now, on program, Claremont Graduate University's School of Community and Global Health is reporting a 66% increase in applicants for its Master's in Public Health program from March 20 to March 2021. Yet on the flip side, you have to wonder too if public health professions hold much appeal given some of the downsides. The public is fatigued by living their lives by seeing everything through the lens of a pandemic. The threats of those who resented public health officials, who advocated for lockdowns and other safety measures, and even worse, the disease and death so many of us witnessed amongst our own colleagues who contracted COVID-19. Yet I do have optimism, and at the end of the day, young people will be inspired to be part of solving future pandemics and other public health challenges that we see on the horizon. So we need them. And to that, I'd like to say thank you, Dr. Fauci, and phone call. Don't forget about me, you and me. Like, come on, Dr. Fauci. Like, together, we are going to rebuild the public health system with a scaffolding of strength. All right, so stay on the lookout for our regular updates. And to read more about the sources used in this report, go to the acoi.org/COVID-19. You see how good I did that? Together with the ACOI, will help you have the latest information to help you respond to your patients and stay on top of the crisis. And please feel free to reach out to me at madery@scaffolding.com. Please stay safe. We can do this together.